If you were to walk into a doctor's office today complaining about severe pelvic floor issues, the solutions you'd be offered might feel a bit, well,
A bit medieval.
yeah, exactly. I mean, we are talking about an incredibly common, often totally debilitating reality for women as they age.
Right.
And for decades, the medical approach has been to treat this complex living part of the human body like a broken piece of furniture.
It's so true.
You either flood the entire system with hormones or you literally try to nail the structure back together with like synthetic plastic mesh.
Which is wild, because both of those approaches completely ignore the fundamental reality of human biomechanics.
Mm-hmm.
The female pelvic floor is the absolute definition of a dynamic living architecture.
Right.
When you try to patch a failing breathing ecosystem with rigid steel or unyielding plastic, you're setting the stage for a catastrophic failure.
Well, welcome to the deep dive, everyone. Today's mission is kind of a detective story, taking us deep inside the human body.
And it is a fascinating one.
It really is. We are exploring the cutting-edge science of how aging vulvar and pelvic tissue can actually be regenerated, like from the inside out.
Yes.
We're throwing out the synthetic meshes. We're moving past the traditional hormone replacement therapies.
We are diving into a stack of medical research papers that focus on something, honestly, far more elegant.
Right, because science is pivoting to tissue engineering now, specifically looking at mesenchymal stem cells.
Yeah, but the real twist here isn't the stem cells themselves. It's their secret weapon.
Oh, yes.
It's this phenomenon called cell-free biological communication.
Yeah, cell-free. So for you listening, we're zooming all the way down to the nanoscale today. We're going to see how tiny little biological packages can literally reprogram your local tissue's stem cell niches.
Which sounds like science fiction, I know.
Totally. We're talking about reversing the biological clock on vaginal atrophy and pelvic floor disorders. And it does involve some heavy cellular biology, but I promise we are skipping the dense textbook jargon today.
We want to get straight to the aha moments.
Exactly. And most importantly, explore why this research is revolutionary for women's health.
To really appreciate the solution, though, we have to start by understanding the breakdown.
Right, the mechanics of it.
Yeah, because the pelvic floor isn't just a simple anatomical shelf. You have to think of it as a complex, suspended hammock.
Okay, a hammock.
Right. It's made of neuromuscular units like the levator ani muscles, and those are held together and suspended by this really intricate web of connective tissue.
Which is known as the extracellular matrix, right?
Exactly, the ECM.
And that matrix is where the trouble starts as we age. I mean, menopause hits, estrogen levels basically fall off a cliff, and the whole environment just changes.
Dramatically.
We see vaginal atrophy, meaning the surface tissue thins out. Glycogen production drops, which entirely alters the local microbiome, and well, the blood flow just dries up.
And deeper down, at the molecular level, there's a massive imbalance in how that extracellular matrix is maintained.
But how do we even study that mechanical failure? I mean, it's not like you can put a living human's pelvic floor on a stress testing machine to see when the tissues snap.
No, definitely not. Researchers actually looked to veterinary models for this, specifically an Australian sheep model.
Wait, sheep? Why sheep?
It's super interesting, actually. A sheep's vaginal tissue reacts very similarly to human tissue under mechanical stress and hormonal changes.
Oh, wow. I had no idea.
Yeah, and in sheep that had already given birth, what we call parus tissue researchers found a very specific structural shift.
Okay, what kind of shift?
Well, they had the highest total collagen content, but the lowest elastin. And that correlated with very high tissue stress.
Okay.
But conversely, the pregnant sheep had the lowest collagen, but the highest elastin. That made the tissue highly flexible, but really poor at recovering its shape after repetitive loading.
Okay, let's unpack this with a visual for a second. If you compare the aging pelvic floor to, like, a suspension bridge, the elastin fibers are your flexible steel cables, and the collagen is the concrete.
That's a perfect way to look at it.
So what you're saying is that mechanical stress and hormonal changes completely alter the balance of those building blocks.
Precisely.
With aging and estrogen loss, those flexible cables rust and snap, and the concrete becomes thin, fragmented, and disorganized.
That paints a very vivid picture of the biological degradation, doesn't it?
It really does.
And it perfectly explains why the traditional medical fixes have largely failed.
Yeah.
Historically, the two main options were systemic estrogen or surgery.
Right.
Systemic estrogen is effective for some, sure, but it carries well-documented risks for breast cancer and cardiovascular issues, especially in high-risk populations,
Yeah, many women simply cannot take it.
which leaves surgery as the primary backup.
Right, and for conditions like pelvic organ prolapse, surgeons began using those synthetic polypropylene meshes.
Which was just, yeah,
They essentially tried to reinforce the failing tissue with a permanent, non-absorbable plastic net. Going back to our bridge analogy, it's like slapping a rigid, heavy steel grate over a suspension bridge that's supposed to sway in the wind.
and the biological reaction to that rigid mesh was severe.
I can imagine.
The human immune system immediately recognizes polypropylene as a foreign invader, right? So it triggers this massive foreign body reaction.
The body just attacks it.
It tries to wall off the plastic, leading to chronic inflammation and really dense fibrosis.
Oh, yikes.
Yeah, and the scar tissue that forms is so aggressive that it can actually contract the mesh and the surrounding native tissue by up to 60%.
60%. Wait, you're taking an area that relies on flexibility and shrinking it by more than half with scar tissue?
Exactly.
That explains the extreme stiffness and intractable pain women experience, not to mention the horrifying cases of the mesh, like eroding into the vagina or bladder.
It's terrible. And the mechanical failure of these implants is exactly why tissue engineering scientists abandoned synthetic materials.
Thank goodness.
Right. They turned toward regenerative medicine. They started looking at mesenchymal stem cells, or MSCs.
Okay.
Specifically, they focused on endometrial or menstrual MSCs because the endometrium is the only human tissue that naturally regenerates itself entirely every single month without ever leaving a scar.
Wow. So it's basically the holy grail for scarless healing.
It really is.
But here is the major plot twist in this research stack. The real regenerative breakthrough isn't coming from implanting those living stem cells into the patient.
No, it's not.
Because putting any living foreign cell into the body carries immune risks, right? The researchers asked, how do we get the regenerative benefits of the stem cells without the risks of the cells themselves?
And the answer is their biological mail.
The biological mail. Okay, I love that.
We call these delivery packages exosomes.
Exosomes.
Yeah, they are nano-sized extracellular vesicles. To give you a sense of scale, they are between 30 and 150 nanometers in diameter.
So incredibly tiny.
Microscopic. And they're enclosed in a protective lipid shell.
The way these things are manufactured inside the cell is completely wild to me.
It is so incredibly intricate. A cell doesn't just pinch off a piece of its surface to make an exosome.
No.
No. The process starts deep inside the cell. The cell creates an internal bubble, which is called an endosome.
Okay.
As that bubble matures, its own membrane starts folding inward, creating even smaller bubbles inside the main bubble.
Here's where it gets really interesting. For anyone trying to picture this, it's exactly like a biological matryoshka doll.
Yes.
You have a larger sac entirely filled with tiny bubbles.
Exactly. And then guided by this highly regulated internal shipping department within the cell.
Which is just crazy that a cell has a shipping department.
Right. But that sac travels to the outer edge, fuses with the cell's outer wall, and bursts open. It releases all those tiny inner bubbles, the exosomes, out into the body.
So it's like the cell packs these tiny biological flash drives with very specific information before sending them out.
That's a great analogy.
But what's actually written on those flash drives?
They are carrying a really potent payload. We're talking proteins, messenger RNA, microRNA, and specialized lipids.
Okay, so a lot of complex data.
Yeah, but what makes this therapy so groundbreaking is that it is entirely cell-free.
Because there's no nucleus.
Right, because exosomes lack a nucleus, they are not living organisms, they cannot mutate into tumors.
That's huge.
It is, they boast extremely high biological stability because of that tough outer lipid shell, and they have an immune privilege status.
Meaning the host body doesn't see them as a threat to be attacked.
Exactly.
So they are floating around packed with regenerative software updates. But how do they actually get inside the broken down, aging vulvar cells to deliver that data?
The target cells have multiple ways to absorb them, actually. Sometimes a distressed cell will perform what is called macropinocytosis.
Macropinocytosis.
Yeah, it essentially takes a giant gulp of the surrounding fluid.
Oh, wow.
This pathway becomes highly active when the tissue is under stress or inflamed, which, perfectly describes an atrophied pelvic floor.
Right, it's like a dying cell in a desert, desperately drinking in whatever is nearby.
That's exactly it. Other times, the exosome's lipid layer just melts directly into the target cell's membrane, dumping its cargo inside.
Just fuses right in.
Yeah. But the most fascinating method relies on highly specific docking stations.
Oh.
The target cells have specific glycoproteins on their surface, like TIM1 and TIM4, that act as a lock, and the exosomes have specific lipids that act as the key.
So it is a physical lock and key mechanism, ensuring the regenerative message only opens for the exact right cells.
Exactly. It's incredibly targeted.
Okay, so now we have these biological flash drives successfully penetrating the cells of the aging pelvic floor. Our main focus today is what happens next.
The really good part.
Yeah, what occurs when these exosomes reach what the papers call the stem cell niche in the vulvar tissue?
Well, we need to define the stem cell niche first, because it is central to everything.
Let's do it.
The niche is the exact cellular and molecular microenvironment where your local resident stem cells live. Think of it as their home.
Okay, their home base.
Right. The signals bouncing around in that home dictate the stem cell's fate, whether it stays dormant, divides, or turns into a specific type of tissue.
But when you have vaginal atrophy, that home is basically a ghost town, right?
Yes,
The resident stem cells are asleep because they aren't getting the hormonal signals they used to get. The estrogen is gone.
exactly.
Right.
But when exosomes say those harvested from umbilical cord stem cells are introduced into this degraded niche, they act as an alarm clock.
Oh, I see.
They trigger a process called endogenous cellular turnover.
Endogenous meaning it comes from within. You aren't growing new tissue in a lab and trying to staple it in.
No, not at all.
You are waking up the body's own dormant repair process.
And the results on the vaginal epithelium are staggering.
Yeah.
The research shows these exosomes promote intense proliferation and migration of the basal cells, which form the foundational layer of the vaginal skin. They measure this by looking at markers for active cell division, like the Ki-67 marker. And in the exosome-treated tissues, there is a massive spike in newborn cells.
Okay, wait, if I'm listening to this, a tiny alarm bell is going off in my head right now.
Uh-oh, what is it?
Well, we established earlier that the vaginal epithelium strictly relies on estrogen to proliferate and thicken, right?
Yes, naturally it does.
But you're talking about massive spikes in cell division in an estrogen-deficient menopausal environment. Rapid, uncontrolled cell multiplication, isn't that just a recipe for cancer?
That is the exact right question to ask. It's a very common concern, but here is the critical distinction.
Okay.
The exosomes bypass the traditional estrogen receptor pathway entirely, but they do it in a highly controlled manner.
Wait, how do they go around it without causing chaos?
It comes back to that biological cargo we talked about.
Yeah.
The exosomes deliver active molecules, particularly microRNA, directly into the local niche.
Right.
These molecules activate internal signaling pathways inside the recipient cell, specifically one called the WNT signaling pathway.
The WNT pathway.
Yeah, and this simulates the beneficial cellular effects of estrogen, triggering necessary division and growth without requiring actual systemic estrogen.
Oh, wow.
Because you are using highly targeted, cell-free signals, rather than flooding the entire body with a hormone, you avoid the systemic risks of cancer and cardiovascular issues.
That is incredible. You're hacking the cell to behave as if estrogen is present.
Exactly.
But there's another fascinating layer here regarding how the tissue actually rebuilds itself physically.
Yeah.
Because the sources note that the exosomes don't directly force the cells to differentiate or change shape, do they?
No, they don't. They simply stimulate the rapid multiplication at the foundation,
Right.
which introduces the concept of mechanobiology. Because the basal cells are multiplying so aggressively, they literally run out of room.
Okay.
This creates intense physical pressure at the base layer of the tissue.
It's like packing too many people into a subway car. Eventually, the crowd pressure forces people to move upward to the next level just to find space to breathe.
That's a perfect visual. That physical pressure forces the newly born, undifferentiated cells upward,
Yeah.
and as they are shoved toward the surface, they are forced to alter their connections to one another.
Wow.
They flatten, they reshape, and they naturally form a thick, stratified, keratinized epithelium.
Just from the pressure.
Yes, the mechanical pressure itself drives the tissue to mature and thicken.
That is so cool. Okay, so we've successfully rebuilt the thick, healthy surface tissue of the vagina, relieving symptoms like dryness and burning.
Which is great.
It is, but if you only fix the surface and the foundation underneath is still crumbling, the entire structure is going to collapse again. You need blood supply and structural scaffolding to make it last.
You absolutely have to rebuild the plumbing and the scaffolding, or the surface changes are completely temporary.
Right.
In postmenopausal women, the loss of estrogen leads to the loss of a specific receptor, ER-beta, which is crucial for maintaining vascular smooth muscle.
Okay, and without it.
Without it, the local blood vessels degrade.
Yeah.
The deep tissue literally stars.
But these biological flash drives carry a fix for the plumbing too, don't they?
They do. They deliver potent pro-angiogenic factors, most notably VEGF or vascular endothelial growth factor.
Okay.
When delivered to the deep connective tissue layer, this doesn't just temporarily dilate vessels, it spurs the creation of entirely new blood vessel networks.
New networks.
Yeah, the exosome therapy shows a robust return of microvessels, bringing oxygen and nutrients back to the starved tissue.
So the plumbing is back online? What about the rusted suspension cables, the collagen and elastin we talked about earlier?
The exosomes also seek out local fibroblasts, which are the builder cells of the extracellular matrix.
Okay, the builders.
The exosomes optimize these builders, suppressing the chronic inflammation that breaks tissue down in the first place.
Nice.
And they regulate specific enzymes called MMPs that act like demolition crews.
Oh, I see.
By slowing down those demolition crews, the fibroblasts can restore a healthy, flexible balance of collagen and elastin fibers.
It's basically a complete structural overhaul from the inside out.
It really is.
But, I mean, there is a massive catch to all of this, isn't there?
Yeah.
If I just take a syringe of these exosomes and inject them into my bloodstream, they aren't going to magically find their way to my pelvic floor, are they?
No, they are not. That is the ultimate delivery challenge.
Right.
If you inject exosomes systemically, they wash away rapidly. They get filtered out by the liver or lungs long before they can reprogram the local stem cell niche.
Because you have to deliver them locally.
Yes, but even if a doctor injected them locally into the vulvar tissue suspended in, like, saline, the fluid would just dissipate into the surrounding tissue almost instantly.
Ah, okay. So how do they get them to stay put?
The breakthrough in making this an actual therapy is combining the exosomes with a hyaluronic acid hydrogel.
A hydrogel.
Yeah, the hydrogel is vital. It is a highly biocompatible, viscous matrix that acts as a localized carrier.
Okay. I think of it like a slow drip irrigation hose placed exactly at the roots of a dying plant. You aren't just spraying water indiscriminately with a hose and watching it run off into the gutter.
Exactly. The hydrogel holds the exosomes firmly against the vaginal walls and the stem cell niche, releasing them slowly over a period of several days.
Oh, wow. Days.
Yeah, this gives the tissue time to actually absorb the flash drives. But the hydrogel itself is doing double duty.
How so?
Well, hyaluronic acid acts like a sponge, drawing in immense amounts of water.
Oh, right.
This immediately provides a deeply moist environment that alleviates the severe dryness associated with vaginal atrophy, keeping the patient comfortable while the exosomes do the deep repair work.
That is brilliant. But you know, if you're listening to this and wondering why your doctor hasn't handed you a hydrogel treatment yet,
It's a fair question.
part of the answer lies in the intense quality control required to make this safe, right? I mean, how do researchers ensure they are only harvesting the best possible exosomes? If the stem cells in the lab start turning into random tissue cells before you harvest their exosomes, the whole message gets corrupted.
Yes, safety and purity are absolutely paramount in the manufacturing process. Researchers have to keep the stem cells in a state of pure, undifferentiated potential while they culture them.
How do they do that?
They use highly specific chemical inhibitors like TGF-beta receptor inhibitors during the culturing process to block the stem cells from prematurely maturing into regular fibroblasts.
Okay.
And they use specific markers like SUSD2 to ensure the cell lines stay pure. By keeping the stem cells pristine in the lab, they ensure the exosomes they harvest contain only the purest regenerative instructions.
Wow. So if we pull all these threads together, what we have is a therapy that perfectly mimics the natural, healthy state of the female body.
Precisely.
The hydrogel provides the immediate mechanical support and moisture, while the exosomes deliver the biological software update.
It's an elegant solution.
We are looking at a future where we can resolve the structural stiffness of the deep pelvic floor and the surface-level atrophy simultaneously, entirely avoiding the dangers of permanent synthetic meshes or systemic hormones.
We are taking the body's own regenerative language and speaking it directly to the local tissue stem cell niches that have gone completely silent.
Which is profound.
And that biological communication leaves us with a truly provocative idea for the future of this field.
Oh.
We know that the aging of the stem cell niche itself alters how it receives these signals, right?
Right. An old niche doesn't listen as well as a young one.
Exactly. The ghost town doesn't have as many functioning receivers.
Okay.
But if we can map the exact cellular architecture of these niches at their peak health, could we eventually build entirely artificial biomimetic niches in a lab?
Wait, really? Build a niche?
Yeah, Imagine a near future where we don't just deliver exosomes to an aging, degraded niche. Imagine if we could actually replace the degraded niche environment itself with a 3D printed bioengineered microenvironment.
That is mind-blowing.
We wouldn't just be treating symptoms or slowing down the clock.
Okay.
We would be fundamentally resetting the biological age of our local tissues from the ground up.
Now, that is a thought to linger on. It brings us right back to our suspension bridge, doesn't it?
It does.
We aren't just figuring out how to stop the existing cables from rusting. We are learning how to build a dynamic bridge that constantly, seamlessly repairs its own concrete and steel from the inside out, adapting to the weight of human life in real time.
Beautifully said.
Well, thank you for joining us on this deep dive, everyone. Keep asking the tough questions, keep challenging those rigid models, and keep exploring the hidden dynamic universe inside your own body. We'll catch you next time.